Hi, I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. Coronary artery disease, meaning disease of the arteries of the heart, occurs when the deposition of cholesterol leads to a narrowing of the artery, resulting in a heart attack. Hopefully, you have symptoms before a heart attack occurs, because contrary to what people believe, the most common sign of a heart attack is not arm pain, but it's sudden death. In other words, 50% of people, the first sign of a heart attack is sudden death. In other words, for those people, they don't get a second chance. Over 2,000 people die in the United States each day of a heart attack, which means approximately one person dies every 34 seconds. I've spent the majority of my career doing open heart surgery. The most common procedure I did is called coronary artery bypass surgery, which means putting a conduit to route the blood, and the conduit is a vein or an artery, around a blockage in a heart artery caused by cholesterol deposition into the artery wall. It's amazing to me that much of this can be prevented by aggressively treating one's high cholesterol. And we know the earlier the high cholesterol is detected and the longer it is treated, the better the outcomes. And this is indisputable. But yet, despite the fact that atherosclerotic cardiovascular disease, which again means blocking of the arteries by cholesterol plaque, and is the number one killer of men and women in the United States, people don't want to be treated with medicine, especially statins, to lower the cholesterol. But you will put anything in your body to look buff, especially you gym bros. It's astonishing to me. However, as soon as it comes to sexual dysfunction in men, notably ED, erectile dysfunction, you will do anything and everything to, quote, get it to work, end quote. Well, guess what? The most common cause of erectile dysfunction is vascular disease, specifically endothelial dysfunction and atherosclerosis affecting the penile arteries. Believe it or not, ED is now recognized as an independent predictor and early marker of future cardiovascular events, and current evidence-based recommendations support routine cardiovascular risk assessment in men presenting with ED, especially with vasculogenic, meaning from the arteries, origin. Importantly, ED precedes clinical cardiovascular disease by 2 to 5 years, and this provides a critical window for early intervention with medicines. Epidemiologic and clinical studies consistently show that vasculogenic factors, primarily atherosclerosis and related cardiovascular risk factors, which are hypertension, type 2 diabetes, high cholesterol, and obesity, are the leading contributors to ED, especially in men over 40. ED is the common underlying mechanism linking these risk factors to impaired penile blood flow and erectile function. Okay? Now, while it can occur from neurogenic, which means from your brain or your nervous system, hormonal, psychogenic, and medication-related causes, vascular disease far and away is the major cause in the general population. And age is the strongest risk factor, with prevalence and severity increasing markedly after age 40. That's why you got to attack this early, largely due to the accumulation of vascular comorbidities. The American Urologic Association advises that men who present with ED should be counseled that ED is a risk marker, as I said, for underlying cardiovascular disease, and should undergo a thorough medical and sexual and psychosocial history, a physical exam, selective laboratory testing, including assessment of cardiovascular risk factors, and if necessary, a stress test. So what do we learn? Well, vasculogenic ED due to atherosclerosis and endothelial dysfunction is the most common cause, and its presence is a strong predictor of underlying cardiovascular disease. All men presenting with ED, especially from vascular origin, should undergo comprehensive cardiovascular risk assessment and management as recommended by the American Urologic Association and supported by robust evidence. So I said this slow. I hope everybody absorbs this. Okay, this is so important for men. So get with it, okay? and soften the tone a little bit. And with that, I hope you learned something. Thank you so much for listening. For more information, for guidance, or a consultation with me, you can go to my website, www.paladinmds.com, and have a great day.